Are there new treatments for COPD chronic cough? Imagine finally finding relief from that nagging cough that just won't go away. If you or someone you know has chronic obstructive pulmonary disease, you might be wondering if new options are available to help with that persistent cough. Well, recent advances in medicine are offering some promising possibilities. COPD, or chronic obstructive pulmonary disease, is a progressive lung condition that includes chronic bronchitis and emphysema. It causes airflow blockage, making it hard to breathe and often leading to chronic cough. This cough is caused by ongoing inflammation and irritation in the airways. Now, scientists and doctors are working on new treatments that target these issues more effectively. For example, a medication called Ohtuvayre, approved by the Food and Drug Administration in 2024, is a dual inhibitor that relaxes airway muscles and reduces lung inflammation. This helps improve breathing and can lessen the severity of a chronic cough. Another promising drug is pirfenidone, which was originally used for lung fibrosis but is now being studied for COPD. It reduces airway inflammation and viral activity, which can help decrease cough and other symptoms. In addition, medications called phosphodiesterase for inhibitors, like roflumilast, are already used to lower inflammation and prevent flare-ups, which can also help with coughing. Combining these drugs with inhaled therapies that include long-acting bronchodilators, steroids, and muscarinic antagonists has shown to be more effective for severe COPD. These combination treatments help open the airways and reduce inflammation, making coughs less frequent and less intense. Some doctors also recommend low-dose long-term macrolide antibiotics, which have anti-inflammatory effects beyond fighting infections. They can help reduce coughing episodes in some patients. Researchers are also exploring experimental cell-based therapies, like transplanting airway progenitor cells to repair lung tissue damage. While these are still in early stages, they have shown some promise in improving lung function and reducing cough in severe cases. Lastly, non-drug approaches like pulmonary rehabilitation, which includes exercise and breathing training, can help improve overall lung health and reduce symptoms, including chronic cough. So, yes, there are new treatments emerging that focus on reducing airway inflammation and improving airflow. These options aim to help manage symptoms better and give patients more control over their condition. If you or a loved one are dealing with a persistent cough due to COPD, talking to a healthcare provider about these new therapies could be a step toward relief.